Hello everyone, I'm Dr. Afrin Rajoy and today we are going to talk about internal family systems or IFS. Internal family systems was designed and developed by Richard Schwartz in early 90s, and the history behind it is really interesting. So he was in therapy with different clients and he realized that clients, they talk about all these different parts in themselves when they are in therapy. And because of the training that he had in family therapy and systemic perspective systems theory, he was wondering if there's a way to change the relationship between these parts, and because of that, he designed IFS to be more collaborative and enjoyable. Previously, people like Freud, they talked about these different parts in mind, right? So Freud called them id, ego, and superego. But one of the differences is that when Richard Schwartz was working on it, he really tried to bring this systemic perspective and family therapy, family thinking into the model and then make it more relational and more collaborative as we work with it. So he talked about different parts, which we are going to talk about it in a second. One of the reasons that we call this approach internal family systems is because they believe that there is this family system inside each of us, right? So we are going to talk about all these different parts and aspects of it in more details as we move forward in this lecture. But just for the sake of understanding, to understand the different parts of self that Richard was talking about, we are going to consider this family system, which is, inside all of us as a company, right? So they believe that each person has a self, and then consider that self as the CEO of the company, right? And then there are all these different unknown number of parts in each of us, in each company, in each system, right? But there are three main distinct types of parts in this model. So they called it managers, exiles, and firefighters. Consider them that as vice president in this company, right? So we have one CEO, which is the self, and then we have vice president of the company, which are, managers, exiles, and firefighters. So managers are responsible, or the family of managers, they are responsible for maintaining a functioning level of consciousness in daily life by warding off any unwanted or counterproductive interactions, emotions, or experiences resulting from external factors, right? Exiles, or the family of exiles, they are most often in a state of pain or trauma, which may result from childhood experiences. So managers and firefighters exile these parts and prevent them from reaching the conscious level so that proper functioning and preservation are maintained in us, right? In the self. Then the last part, or the last vice president sort of, are firefighters. And the family of firefighters, they serve as a distraction to the mind when exiles, and remember exiles, it has to do with pain and trauma, and pain and trauma that comes from childhood experiences. So they serve as a distraction to the mind when exiles break free from suppression, right? So in order to protect the consciousness from feeling the pain of the exiles, firefighters prompt a person to act on impulse and engage in behaviors that are like addictive or oftentimes abusive, right? So firefighters may redirect attention to other areas such as sex, work, food, alcohol, social media, right? All these different things, kind of like to save the person, the self, from experiencing too much pain. Okay, now that you are familiar with the different parts, let's talk about the assumptions of this approach. So as we mentioned, as we talked about, IFS believes that there are different parts, different kind of like sub-personalities in each of us, right? And then we have self, which, each person has a self. As I mentioned, it's like the CEO of the company, the agent, like the chief agent, right? And then the next ones are more interesting, the assumptions that you see here. So IFS really believes that there is no such a thing as bad parts, right? So each of these parts, they are doing their job when it's necessary. What we want to do, or what we want to have in therapy, or in our systems, is to achieve this goal of non-extreme behavior. And I think that this is kind of like very understandable, even like in terms of our everyday life, when you consider it about the small or big behaviors that we have. Even like the behaviors or the things that we do, and they are like, they consider quote unquote healthy or positive, right? Even for those behaviors, we do not want to have them too much, right? So for example, drinking water, all of us, we know that it's good for our health and body, right? And at the same time, if you drink too much water on a daily basis, it is not good for your body. So again, like, IFS has this non-pathologizing perspective, and there's no bad part. What we see is sometimes extreme behaviors in some of these parts, and as we talked earlier, we want to change the relationship that these parts have, right? We want to say, hey, tell one part that, hey, just be relaxed, the other part is just doing its job, right? And kind of like redirecting the behavior from extreme to non-extreme. And then the next assumption is that changes in the internal system will affect changes in the external system and vice versa. Again, like an example of that, if you just want to imagine, is like a family system, right? When we have a family, and when we have two persons who are in a relationship together, right? All these different changes that may occur in their lives, if they move to another country, if once they have a pet, once they have a child, once they have the second child, right? Once they adopt another child, all these different changes, they are going to impact the internal system, and at the same time, the changes that they have in their internal system would impact external system, right? About like their job, their work, how often they can have social interactions, all these different things. So consider that for the parts that we are talking here in IFS. Let's talk about these parts in more details, and let's start with exiles. So first of all, we all have these parts, right? So exiles are about pain and trauma and experiences that usually they come from childhood. So these experiences, these usually stories, they become isolated from the rest of the system just because these parts wanted to protect us from pain and suffering. But really, exiles are about the fact that they want to inform us where we come from, and the stories, the experiences that we have, where they come from, right? So, and again, like as I mentioned, most of them, they come from childhood. For all of us, we all experience pain and trauma to some level. For some people, it may not get to the point that they have PTSD about it, or nightmare or flashback, or those symptoms. But we all have it because the whole system, the whole world, the whole system that we live in, it's not perfect, and because it's not perfect, we are going to experience pain as part of the life. So usually what happens is with exiles and with those memories and pain and stories, people, they have these strong beliefs. It's about exiles, right? So exiles, they have these strong beliefs and feelings, which is about that extreme behavior that we were talking about, right? It gets to the point that people, they have these feelings or thoughts about themselves. For example, the feeling that they have, like, I'm not loved, or the belief that they have that I'm not worthy of XYZ, right? So those strong beliefs and feelings, they come from exiles parts in us. And if these stories, these experiences, they remain untold, then it can lead the person to be fragile in their life experiences. So these stories, these parts, exiles, they want to be heard and they want to be loved. And that's one of the things that we are going to do in therapy, right? So besides IFS, we a lot of times in therapy we talk about inner child, right? And we have conversation with it, we talk about it. Exiles are similar to inner child that we usually talk about in therapy. Now let's talk about managers. So managers, their family, they are really proactive and they want to do anything to avoid hurt and pain and basically avoid exiles activation. So if exiles, if they are telling a story, if the feeling starts, coming up to the surface and those kinds of experiences, then out of a sudden managers, they become active and they try to do different things. They have different strategies to control the situation, right? But remember, we still have the CEO of the company, the self, right? The self is the CEO of the company. So the self could tell managers, hey, I appreciate that you are doing this, but at this moment, at this time, I think that it's good that we feel the pain, we feel the hurt, we hear the story, right? These parts, they need to be heard and they need to be loved, and we need to feel and see what's going on. So thank you, but just for now, you don't need to do anything. So still the self has the last word, kind of like in this whole family systems. So some of the common behaviors that managers do include controlling, kind of like evaluation of the situation, what's going on, caretaking, perfectionism, people pleasing, all these different things, right? So again, like consider this as a spectrum, right? So it could be positive, negative, and then it could be extreme, non-extreme, and they are kind of like moving on this spectrum. So all the behaviors that they do, sometimes it could be functional, sometimes it could be very helpful, and also there are these other times that they are not as helpful as they think they are. So we are here with the self and with therapy to help change the relationship between these parts and to have more to promote the agency for the self, right? So some of the common symptoms of managers include panic attack, emotional detachment, somatic complaints, and depressive episodes. Again, remember, managers, they are here to control the situation. And when that control from their perspective, when it's not happening for any reasons, then all these different things, they can happen, right? So for example, when you are in a stressful situation, when you lose a loved one, or when there's this exam and you know that it's so important for your future and for your career, but you didn't pass the exam, right? You feel the pain, you feel the hurt, and then because of the pain and the hurt could be too much, then the managers, maybe they want to control the situation with all the behaviors that they know, right? Maybe controlling, ignoring the different things that they do. If for some reasons they are not successful, for example, the pain is just too much, so you cannot ignore it, right? Or the love is which is there for that loved person is just too much, you cannot ignore losing that person, right? If they are not successful in their mission, which is controlling the situation, then you might experience panic attack. Or sometimes what we see is emotional detachment, which is about kind of like what we in EFT we call insecure attachment, right? So when you see that when there's this person in front of you or thing, experience in front of you, and you just say, hey, you experience, you, this person, you don't matter at all, like I don't care about you at all, but deep down you care a lot, right? So that is like emotional detachment that sometimes happens, that I don't care, you're not part of my life. Somatic complaints, we all know what they are about, right? And then depressive episodes, again, like one symptom or symptoms that can happen when managers, they feel like they are not in control of the situation. Coming back to therapy, so we have therapy based on IFS, so we can change the relationship between these parts, right? And we can give the self more autonomy and more agency in saying what you need to do when, right? So in therapy, a lot of times we need to let the pain, the story, be heard and be told, because that is something that could be more helpful rather than ignoring the pain, right? And just so you know, so you have in mind that what we mentioned in the beginning, that these parts, there's no bad part, right? And just it's about the extreme of the behavior. For example, I usually tell this example to my students and my supervisors, that with grief and the different stages that we have in grief, when we have that denial part, it's not like that the denial is just 100% negative, right? It's not like that it's so bad that it should not exist. It has its own function. Denial happens because the pain that you are experiencing is just too much, too heavy, that if you experience it in that moment, in that place, you may just break down, right? You may not, your mind, your psychosocial, spiritual aspects of your health may not be ready to face that experience, and because of that you go through denial, which could be fine, right? Again, like talking about extreme, if it's like if you carry that denial for a long time, or if you are not aware of what's happening here, the fact that I'm denying the situation, then that is something that we want to work on, right? So just have that in mind as well. Okay, now let's talk about firefighters. So they are really similar to managers in terms of the goals that they have, right? But they have very different strategies. So again, like their job is distract us from the pain, but usually they come after the managers. So pain, hurt, those stories or experiences, they happen or they happened in the past. Now they come up to surface, and then first managers as kind of like vice presidents, who want to show the company that like everything is good, there's nothing going on, kind of like the show that everything looks good, right? If they are not successful in their mission, then firefighters come to the scene, right? It's like something happens, you try to there's this smoke detector at your home, like in your home, right? And then it goes off, and then first you try to control the situation, check the place and everything, and then if you are not successful, then you see that firefighters are there to kind of like rescue you, right? They are doing the same thing in us. They want to rescue us from the pain and from the suffering. So usually they have this conflict with managers because of the different strategies that they use, right? So if a situation come up, and there's hurt, there's pain, and there's uncomfortable stories or emotions, and managers, they cannot do anything about it, then they would say, what were you doing? What were you thinking, right? There's still pain. I see that. I still see the leak here, kind of like, right? So they are very reactive, kind of like some of those autopilot behaviors or thoughts that we see in people. And whenever we see exiles active, kind of like we see firefighters get active as well, unless managers control the situation in a second. So some of the common behaviors that you see in them include alcohol, drug, harming, overeating. Basically they do these kinds of behaviors to put out the fire, to say, hey, look at here, look at me, there's something going on here, but you are not seeing it, you are not paying attention to it, right? So let's go with that example of grief that I told you before. So imagine something happens, people, a family, they're going through this grief process, and someone lost just a loved one, right? The first reaction is just, obviously there's just too much pain, too much hurt, too much untold grief, untold love, everything like that. And then because the client is feeling the pain, then managers, they come to the scene, right? They want to avoid the pain, the hurt, so they do all these different things. They try to control the situation, and then because just the pain is too much, or whatever other reason, they are not successful. So the pain, the hurt is still there, right, in that person. Then firefighters, they come to the scene, and they're like, oh my God, what's going on? There's so much pain. We need to distract you from the pain. And then sometimes you see that people who are going through grief, they use alcohol too much. They use, some sort of self-harming behaviors, drug, overeating, all these different behaviors, right? So kind of like distracting the person from the pain, and kind of like making a distraction, fire somewhere else, so you cannot, or at least for a moment, temporary, you don't feel the pain, you don't see the pain. And then self. So as we talked about it before, self is the CEO of the company, is the CEO of this internal system, right? And it should be the moderator. It is the moderator, and it should be the moderator, and it should lead the internal system, right? So imagine like having a meeting at a company when there is the CEO, and then there are all these vice presidents and then other employee. Of course that the CEO has the last word, right? So a good CEO, a differentiated CEO self could say, hey, now today we are going to talk about this topic, and it's hurtful, right? It's difficult, but I want to hear from Exiles. Then I want to hear from managers. Or it could say, hey, today I don't want to hear from firefighters, just Exiles, right? So a differentiated self is secure and competent. It knows what it's doing, right? And a not differentiated self, it's wounded. And when it's wounded, one of these parts, one of these vice presidents could take over of what the self was doing, right? Now we see a person who is very impulsive. We see a person who has or does all these extreme behaviors. We see addiction in people, right? So it's really interesting to think about it as we're talking about therapy, that one of the things that we want to happen in therapy in IFS is helping people, helping clients, families to ask good questions, and to be able to ask good questions and to tell their stories, and kind of like challenge themselves on hearing their stories and asking good questions, right? So when XYZ happened in my life, when there's this divorce in my life, and I know that thinking about it is just so hurtful and painful, and I don't want to think about it, right? Then you see how some of the mistakes or some of the stories that happened in the previous relationship, you as a therapist, you see how they are impacting the relationship that this person has today, right? Some of the patterns, some of the stories, some of the wounds that happened before, right? And then one of the things that that person could do, based on IFS, is just realizing that it seems like there's all these, the Exiles family, they are here, and they want to tell you a story, but you don't want to hear it, right? Because it's too painful. And maybe you, as the self, you can have this authority and kind of like courage to ask a good question and to ask yourself, do I want to hear a story? Is there a lesson in it? Do I want to take away some lessons from the past experience? Is there something, is there a wound that, although it's very, very, very painful, I want to go and check it and see if it's there's any infection in it, there's something that I need to take care of, right? So you're going to ask managers and firefighters to be quiet for a while, right? You're going to tell them that, hey, I know, you want to save me, but for a second, I just need to go through this story and feel all the pain and, goods and bads and everything, because I think there's something that I should take care about. What are the goals in IFS? Balance and harmony within the internal system, free parts from extreme behaviors, and differentiate and elevate the self. So remember, we have the self, we have self as the CEO. So what we want to do, what we want to happen in therapy is promoting the self, right? Making it more powerful, and put it kind of like in charge of the whole system if it's not, right? So making it more highlighted kind of than before, and we're going to talk about it in a second how. The other thing that we want is, as we started the lecture with this, that we want these parts to have a different relationship with each other, right? Because it is possible to have a different relationship and a different harmony in the system. We do not want to eliminate any of the parts, because all of them, as you remember, they are not bad. All of them, they are necessarily in their place and in the correct kind of like place and moment. So we want to have them. We just need to have a balance and harmony within the internal system. The other thing that we want to do is we want them for the parts to not have the extreme behaviors. So in other words, we can say we want them to adopt, more healthy, quote unquote, healthy strategies or coping strategies, right? So for example, for the exiles, what we want to happen in therapy is help clients to differentiate the past from the present, right? So what happened in the past, it's painful. If it was painful, hurtful, whatever the story was about or is about, and that is very valid, and that is what we want to talk about. At the same time, that does not mean that like the same story is going on right now, right? So I know that, for example, I know that what happened to you in your childhood in terms of the parenting and the relationship that you had with your mom or dad, it was really painful, blah blah blah, right? But that does not mean that in your relationship today with your partner you are going to experience the same trust issue or the same safety issue, right? So talking about it and kind of like separating the past from the present. For the managers and for firefighters, the same thing. We want them to adapt like more quote unquote healthy and helpful strategies or coping mechanism, right? So for example, for managers, we want them to know that you can take a maybe this experience, this past divorce or whatever it was, like it's hurtful, it's painful, but let's go through that and take some lessons so we don't repeat the same mistake or story in the future, right? And then for firefighters, since they are like more kind of like reactive, we want them to adapt more healthy or helpful coping mechanism, right? So instead of avoiding this situation and like go using drug or addiction or alcohol or whatever for a long time, maybe there's this other coping mechanism. Maybe you can start journaling and talking about what's going on. Maybe you can adapt a different kind of coping mechanism or strategy when you are facing the pain instead of going to the extreme behavior. As the IFS therapists, we want to access clients' parts and we want to bring the awareness of various parts in our sessions, and we want to have respect for the different parts and kind of like convey or pass that respect to our clients as well, so they know that they should have respect for different parts as well. So because of that, introducing IFS language is very important in this approach and therapy. So one of the things that we are looking for in the process of therapy is any sort of like polarization. And again, like remember we were talking about the self and kind of like one of the goals that is bringing harmony to the internal system. So polarization is or happens when we have we have these parts who are taking over the whole system, right? So kind of it's similar to what we have in DSM and the DSM diagnosis that we have that kind of language. So for example, with PTSD, exiles are taking over, right? With substance use disorder, firefighters, they are taking over. With somatic symptoms disorder, the managers, they are taking over, right? So we want to be very mindful of that because that tells us something about the person and the internal system, right? So the other part of the process is that obviously we want to work on the relationship between internal and external system, right? It's really important because and we want to be actually mindful of the dynamic and the relationship between them. And it's really important because the way you relate to your own parts, it has to do with the way you relate to those parts of others, right? So how you have empathy for yourself, right? Exiles, how you have empathy for yourself, how you see the pain, and how you hear the story, the pain of difficult times in yourself is really important in how you have reaction and you relate to others people pain or difficult situations, right? And how you can have empathy for them. The other thing is that in therapy we want to have an agreement about goals. Often they talked about even like having a contract with clients, and One important aspect of the process in IFS is the first thing that you need to do is you need to access managers' fears and, kind of like what we say clients' triggers, and make a relationship and have a rapport kind of like with the manager's part, because that would help you to have access to exiles and firefighters. You even like work with firefighters through managers. Looking for parts are which are activated in a session is again like important, because again like that tells you something about the internal system, the balance, and who is in charge. Make sure that in your session you work with managers first, as I just mentioned. Evaluate and have assessment for managers' fears, and then work with exiles then with the permission from the managers, right? Otherwise, probably from what they believe, therapy will not be successful, because then you cannot really have access to those painful and hurtful memories. And then you really want to check in frequently to see if every part, if managers family, exiles family, firefighters, if they are doing okay, and if they are okay with the kind of like trajectory of therapy and what you're talking about in therapy, as often as possible. To do all the things that we have mentioned so far, there are different techniques and interventions that you can use in IFS. But to mention just a few of them here, two kind of like general category of them would be non-imaging techniques and imaging techniques. Non-imaging techniques, as it says, it includes like techniques such as keeping a journal, writing about all these different parts, the feelings, thoughts, right? Or for example, using diagrams to draw the relationship between the different parts, or the parts between one person and then another person, right? Um, Imaging techniques include, like as it sounds like, imaging something, right? So for example, the room technique, and with the room technique, you ask, in this technique, one part watches as the self interacts with another part, right? So when you see polarized parts together, right? Sorry, in a session, and you want to bring back them together and have a better relationship and bring back harmony and balance, one of the things that you can use is this the room technique. From my perspective, it's similar to empty chair in some ways, but obviously it has its own differences, right? So in this technique, you ask the person, the individual, to have to kind of like observe and imagine this inner dialogue between the different parts. Or for example, we have feeling one's heart, and in this technique, an individual is actually encouraged to breathe, relax, and feel the heart. And does it feel emotionally open, or is it like closed? And the individual may ask the protectors to step back for a while, so the exiles may be better understood. The other technique is like when just about imaging, is like when you ask people to think about a specific story, and then you ask them to see where to imagine where they feel which part of their body they feel what they feel, right? So they say, hey, at this moment when I'm remembering XYZ, I feel like I have shame or fear or disappointment. And then you ask them, where do you feel that in your body? Kind of like again, like going to details about a story, and having that imagination about what's going on and the inner dialogue between different parts or different family members in a session. Some of the common mistakes that sometimes therapists do with IFS includes working with Exile before the system is ready. And it's very common. We always hear that when we want to work with trauma, hurt, pain, we really want to make sure that the person is ready and the system can handle the pain, right? Otherwise, the harm would be more than the help, and we don't want that in therapy. That is why we need to, have that relationship with managers and, make sure that the system is ready to handle the pain. The other mistake is that sometimes therapists, they assume that they are talking to person's self when they are talking to a part. So as the therapist, you really need to be mindful of and aware of all these different parts, their characteristics, and have the training, because it is possible that if we are in the beginning of the journey, we are just talking to the, for example, manager, and we think that it's the self, while it's not, right? So, and that's when mistakes, manipulation, and those kinds of things may happen. And the last one is when therapists, they think that self is doing the work, but it's really a part, which is similar to the previous one. You really again want to know each of these parts, their job, their function, and the way that they manipulate this story. So when they are working and they are not working, you are aware of that, and you can lead the conversation with the client about it. And then if we have a successful therapy based on IFS with clients, we see that the self is compassionate, creative, curious, connected, courage, confident, has the clarity, and it is calm. The hope is that with all the different trainings that you would have in IFS model, at the end of the day, the self of the therapist, the CEO of the person who is the therapist, is playful, patient, present, persistent, and uses multiple perspectives. Seems like there is not that many dialogues, conversations, and discourses about diversity and culture in IFS. So I was wondering if for this lecture you actually think about and reflect on what you think of the diversity and culture in IFS model. What do you think? Is it a strength? Is it a criticism? Is it something that we need to work on more? Let me know if you have any comments and reflection. Thank you for watching.